under God, indivisible, with liberty and justice for all.
Please be seated. Before our meeting starts, I have a required reading. Any citizen desiring to address the hospital board should turn in a speaker card at the board to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in the meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. I'd like to call the meeting to order. The comment and the first item is the approval of the orders of the day. I'd ask for a motion approving the orders of the day.
So move.
All in favor, respond by saying yes.
Yes.
Carried, thank you. Approval of the minutes of the meeting of April 19th of this year. I'd ask for a motion. Have a second? Questions, comments? All in favor, respond by saying yes. Motion carries. There are no board reports. Report of the medical staff. Dr. Wasson, please.
Thank you. Hello? Yep, thank you. I would like to ask for a motion, Mr. Chairman, to approve Sarasota Memorial Hospital, Sarasota physician privileging forms for infectious disease, neurology, pediatric neurology, diagnostic and interventional radiology, and advanced practice professionals with privileging forms for CRNAs working with anesthesiologists, all as recommended by the SMH Sarasota Medical Executive Committee.
All those in favor respond by saying yes. Opposed? Motion carries. Thank you very much, Doctor.
Thank you.
Sarah Lodge, the Secretary's report, please. Okay, I'm sorry. Dr. Fiorica?
Yes, thank you. On behalf of the leadership of SMH-Venice Hospital, I would like to ask for a motion to approve Sarasota Memorial Hospital Venice physician privileging forms for infectious disease, neurology, diagnostic and interventional radiology, advanced practice professional privileging forms for CRNAs working with anesthesiologists, all as recommended by the SMH-Venice Medical Executive Committee.
Second? All in favor respond by saying yes. Motion carries. Thank you, Doctor. Up next, Sarah Lodge, Secretary's report. Sarah?
Thank you. Our next meeting will be Thursday, June 3rd from 8 to 11 a.m. for the Strategic Planning Retreat. This is a closed meeting and a court reporter will be present. And then on Monday, June 21st from 9 to 10:30, Governance Effectiveness Committee. From 10:30 to noon, Mission and Planning Committee. From noon to 12:30, closed session hospital board meeting. From 12:30 to 2, board lunch, issues and financial review. And from 2 to 4, the board meeting.
Thank you, Sarah. Treasurer's report, Joseph DiVirgilio. Please, Joe.
I have one item, approval of the bad debt and charity care. I move approval of the bad debt and charity care for the month ending April 30th, 2021, in the amount of $18,756,000.
Do we have a second? All those in favor respond by saying yes. Opposed? Motion carries. Thanks, Joe. Financial highlights. Chief Financial Officer Bill Bulger. Bill, please.
Thank you, Mr. Chairman. I have the highlights for April. And we'll start with me turning this on. There we go. Total revenue for the system in the rating agency format. For April, we had revenue of $103,724,000 compared to a budget of $95 $538,000. Through 7 months of our fiscal year, total revenue of $672,899,000 compared to a budget of $652,470,000. Looking at total expenses for the system in the rating agency format for April, $95,888,000 compared to a budget of $90,732,000. Through 7 months of the
Gerald.
fiscal year,
Henry.
total expenses of $616,000,000
Has left the meeting.
$308,000 compared to a budget of $614,762,000. The operating income for the system in the rating agency format for April, $7,836,000, which was an operating margin of 7.6%, comparing favorably to the budget of $4,796,000. We budgeted an operating margin of 5%. Through 7 months, our operating income $56,591,000, which is an operating margin of 8.4%, against the budget of $37,708,000. We budgeted through 7 months 5.8% operating margin. Moving to statistics, and these are fiscal year-to-date numbers for average daily occupancy, 653 patients per day compared to a budget of 611. The average acute length of stay, 4.7 days, and last year was 4.38 days. Admissions, through 7 months, 26,100 compared to a budget of 26,124. And for surgery cases, so far we've had 14,120 compared to a budget of 14,814. And through 7 months, births have been 2,174 compared to a budget of 2,276. Continuing with statistics, outpatient registrations from the hospital, 291,294 compared to a budget of 295,491. And between our two emergency care centers, we've had 65,562 registrations compared to a budget of 75,346. Last item in my slide deck, case mix index for all patients through 7 months, 1.88, and for Medicare patients, 2.03. Mr. Chairman, that concludes.
Gerald Henry.
Thank you, Bill. Committee reports, Human Resources.
Has joined the
Committee,
meeting.
Director Carter, our chair, please.
Okay, we're back on.
Thank you, Mr. Chairman. Lori Bennett, Vice President of Human Resources, gave a report to the board for fiscal year 2021. She began the presentation by reviewing the current state of the SMH workforce. She went on to over the system's volumes, including inpatient and outpatient services, first physicians group, and did a environmental scan on current labor changes, including the need for 2,500 new staff for our growing system in a competitive labor market. She discussed the incredible growth that had already taken place, going from 4,920 to 6,972 employees in the past 5 years, matching our volume increases and the projected need to go to 10,000 employees over the next 4 years. Next, Lori discussed the system's workforce, demographics, and turnover statistics. She then went over current human resources key initiatives for recruitment, benefits, and compensation rewards. She highlighted the importance of these projects in order to add stability and capability in the delivery of HR services to the organization. Lastly, Lori presented the recruitment project update for Venice Hospital, Cancer Institute, and Sarasota campus backfill. Venice Hospital is expecting to need approximately 1,000 FTEs, and Cancer Institute is expecting to need approximately 161 full-time employees to meet volume projections. She then briefly discussed the hiring and onboarding process. The Cancer Institute and SMH-Venice are scheduled to open in the fall of 2021. And that concludes my report, Mr. Chair.
Thank you, Craig. Finance Committee, Britt, please.
Thank you. The minutes of the January 19th, 2021 joint meeting of the Finance and Audit Committees were approved. We also had J.R. Edmiston, Director of Revenue Cycle, who presented an overview of the Case Management Department's functions, leadership, accomplishments, and improvement projects. J.R. discussed recent successes relating to patient throughput and capacity, achievements of the Utilization Review Committee, and current challenges. Joan Toohey, the RN Manager of Case Management, presented examples of how case managers have made a very positive impact in patient experience. Bill Wolgen gave an update on the CARES Act Provider Relief Fund grant. The system was granted approximately $34 million from the fund. The amount of provider relief funds we will be able to recognize as revenue continues to increase as COVID-related expenses are incurred through June 30th, 2021. At this time, the entire amount is treated as an asset and liability on the balance sheet. Bill Wolgen also presented a request to increase the fiscal year 2021 capital budget by $514,763 for equipment that has been purchased to fight COVID-19. If the capital budget were not increased for these purchases, we would not be able to purchase other items in the approved budget. Based on the foregoing, I move approval of an increase to the fiscal year 2021 capital budget in the amount of $514,763 to reflect equipment purchased to fight COVID-19 as recommended by the Finance Committee.
Thank you. All those in favor respond by saying yes.
No.
Hearing none, carried.
Thank you. That concludes my
Thank you
report.
very much, Britt. Next up is the President's report. David Barrender, our President and CEO. David.
There was a comment.
Mr. Henry, did you have something? Did you have a comment?
Yes. I voted no on the budget because I didn't hear any advanced planning for the Northport facility.
Thank you, Mr. Henry. Okay, I'm going to start with our organizational report card. As we do each and every month, I'm going to look at, we have 5 areas of concentration that we look at this. The first being service. We have our goal in our service area of having our likelihood of recommending having 8 out of the 10 areas that we review be at or above the 70 top. We are meeting that goal, and we are hitting 8 out of 10, and I will show you the detail on that here in a second. In the people pillar, we have new hire retention, which is the percent of our full-time and part-time employees that were hired in fiscal year 2021 that are still employed as of the end of the year. We have a goal of that being at 83% or higher. Happy to report that we are trending that, we are beating that number as well at 90.52%. In a quality goal, we have our goals having our infection prevention, our combined overall standardized infection rate being less than 0.88. I'm happy to report that we are exceeding that goal at 0.72. Just to remind the board that the national average or expected number on that is 1.0, so we are considerably less than the national average in that area. In finance area, you've heard our finances presented by our CFO, Bill Wolgen. We have our goal is having our operating margin be at our budget or exceeding that, which is 5.5%. We are exceeding, or we're expecting to exceed that and end up at the end of the year at 7.1%. And then finally, in growth, we have 2 goals. The first being our inpatient admissions and observation outpatients, being at 51,164,000 patients. We are slightly under that is our projection right now at 51,125,000. Any outpatient registrations, we have a goal of having 977,000 patients or registrations. We are slightly below that as well in our projections at 962,000. Looking at the detailed and the patient experience report, just to orient you on the screen that's in front of you, likelihood of recommending is what we look at, and then we look at it within these 10 areas of the system that are on the left. The middle column is what our actual scores are. The next one over to the right is a national median score, and then finally the 75th percentile score, which is the what we have our goal set around. We have hit 8 out of 10. The two that we are not at the 75th percentile on are the emergency care center at SMH and the one in Northport. I will tell you those are both been severely affected by COVID. And I think that especially the center at SMH has been significantly impacted by COVID during this year. The other interesting thing is most of the scores that make up the say 86 and the 75th percentile are still months that are prior to COVID hitting. So our numbers are actual what we are seeing right now, but the national averages still have prior to COVID months in. So it's a little bit of apples and oranges. Usually not a problem, but in this case, we don't really know what that's going to affect when they start breaking in. Next page is SMH earns awards for quality and safety. Sarasota Memorial continues to lead the region in quality and safety, earning a 5-star rating in overall quality from the federal government and another A for patient safety and Leapfrog Group's hospital report card. The 5-star quality rating makes Sarasota Memorial the only hospital in Florida to consistently earn the CMS highest quality award since the rating system started launched in 2016. And I believe we're one of only 48, maybe or even less than that now, but 48 hospitals nationwide that have been 5-star ever since it started in 2016. And then Sarasota Memorial also retained a straight A streak for patient safety, earning consecutive A's every cycle since we began participating in the Leapfrog survey back in 2016. SMH joins clinical study to reduce dangerous inflammation in COVID-19 patients. Sarasota Memorial has a new experimental treatment in its arsenal to try to reduce deadly inflammation experienced by some patients hospitalized with severe COVID-19. SMH is one of more than a dozen research sites across the nation participating in a multi-center trial of IC14, an anti-CD14 monoclonal antibody drug. The main goal of the study is to determine whether treatment with IC14 decreases the time it takes for people with COVID-19 respiratory disease to recover such that they no longer need ongoing medical care in the hospital, and the results are expected in early 2021. We were the first site to enroll a patient in phase 2 trial. SMH honors our incredible nurses. We celebrated National Nurses Week this month, recognizing the exceptional work of our more than 2,400 nurses and over 680 PCTs and MSTs. While we had to forego large staff recognition events due to the pandemic precautions, we still carried on with a number of Nurse Week traditions, including honoring our nurses and PCTs and MSTs of excellence and handing out goodies and gear, including special socks donated by the Healthcare Foundation and other gifts donated by hospital partners. SMH recognizes National Volunteer Week. National Volunteer Week in April was an opportunity to pay tribute to our dedicated team of volunteers who generously contribute their expertise and time to the health system. SMH's hundreds of volunteers make the hospital and our community a better place. The laboratory celebrates successes. SMH's Laboratory Services Department celebrated National Medical Laboratory Week in April and the timing couldn't have been better. The team had just earned 2-year reaccreditation from the College of American Pathologists following the rigorous on-site survey and the lead CAP survey called the SMH Laboratory one of the best in the nation. The department's numerous accomplishments during the extremely challenging year were also recognized during the launch of its in-house COVID-19 testing and the phased installation of the automated microbiology system. In fiscal year 2020, the department completed more than 3 million tests for the first time ever. And you do see a picture there of Lori Lang and Diane Carter, who is our 22nd award winner for the Hazel Award, which is given to an outstanding lab employee every year. It's that time of the year we get to recognize or welcome our new residents and fellows, and I'm happy to report that we did welcome 14 new internal medicine residents, plus another 9 emergency medicine residents, and then 2 new hospice medicine fellows to our ranks this past July 1, or coming in July. This is we talked about this a little bit earlier today, but we will have the education department come in and give an update to the whole board on everything that is going on in those areas in the next couple months. We have a new kitchen menu and a meal service to transform SMH patient food experience. Exciting changes are underway in SMH's food nutrition services as the department prepares to unveil a fully renovated kitchen and a new patient-centered meal delivery service with menus featuring a large variety of freshly made items. The transformation is scheduled to kick off at the end of June when the overhaul of the kitchens is complete. In addition to giving patients a greater number of fresh meal options that suit their personal taste and diets, the kitchen also will help food nutrition staff prepare and deliver a greater number of meals. So Lori, I think we're all very excited about your construction being done, since I think it's been done on top of my office for the past 6 months. So, yeah, it's not as fun as you thought. The construction progress at SMH-Venice, it continues to move on in a very rapid pace. Sharon is leading our transition teams with her staff, her senior staff, and they are meeting really around the clock to get ready for the operational readiness. Majority of the site utilities are now complete, and the new hospital remains to be open in the fall 2021. We're all just very excited about that happening. And then finally, our construction progress on our Oncology Tower continues to move on also with great pace. Lori Lang is overseeing this along with Kelly Batista. You can see a whole host of things that have happened there, but we remain on schedule to open fall 2021 as well. It is pretty phenomenal looking building if you have a chance to drive by 41 and look back at the campus. So that is my report. I am happy to answer any questions.
Any questions for David? Thank you, David. We have nothing on the consent agenda. Karen, do we have anyone who wishes to speak and address the board?
I have a question, please.
Jim? Mr. Tolleton, you're up.
Mr. Chairman, I have a question for David.
Old board member. I know I'm on the clock, Chairman, so I wrote it down. I want to thank the board for the opportunity to speak today because this is the 35th anniversary of the Excel program, which many of you will remember. We actually had Excel winners here earlier. My thanks to the board and the administration, David and his team, and their predecessors for the support. It's been a very successful program. The Excel Award was born out of an idea to recognize outstanding employees who exemplify the Sarasota Memorial philosophy of care and concern for patients, families, and the community. It is an entirely peer-nominated and selected process. Administration plays only a supporting role, which is why it means so much to those who receive the award. Over the years, we've awarded over 400 outstanding employees. And I know all deeply appreciate it. I mentioned, I was talking to one employee before I came in, that it recognizes employees that go the extra mile. And she said, oh, no. Everyone here goes the extra mile. This is for those that go an extra 2 miles. So, and it was a great tribute to David and the leadership team here, and certainly the board for supporting administration. And while I have another minute, I wanted to acknowledge President Liang here today. She was very supportive of the process to have SMH certified for chaplaincy training. We've got a long history of training chaplains of all faiths for hospital service. And there were a few bureaucratic bumps in the road, as you can imagine, but she was very helpful in resolving those issues. And thanks on behalf of the community, which recognizes the need for care, not only of the body, but of the spiritual care in times of crisis and great stress. So, thank you.
Thank you, Jim, and thank you for your years of service on the hospital board. Carol Ann Kalis, something on
Hey.
legal?
Hey, Mr. Chairman.
Yes.
Tram Hudson, I'd like to say a few comments.
Oh, please, go ahead.
I just want to commend Jim Tollerton. Some of you may not know, but Jim Tollerton was elected to the hospital board back when he was a teenager. Well, actually, maybe not a teenager, but he was 24 years old when he was elected to the hospital board. And he served on the board for 10 years, multiple offices, chairs of committees, continues to support Sarasota Memorial, serves on the board of our side-by-side corporation. I mean, he's just really Mr. Sarasota Memorial. And I want to thank him for funding the Excel program and the work that he does on our behalf. And I would echo his comments about the chaplaincy. I think that's I've had a chance to meet with Chaplain Chuck here at our last meeting, and I think the work that they do in our hospital is very, very important. And I'm glad we are supporting the community with an internship program for chaplains. So thank you, Laurie, for your effort in doing that. Thank you, Mr. Chairman.
Thank you, Tram. Carol Ann, please.
Sure. So the board has before it a resolution with regard to correction of the federal employer identification number. Whereas the Sarasota County Public Hospital District, hereinafter referred to as the district, was established by the Florida legislature as a special taxing district governed by the elected Sarasota County Public Hospital Board, hereinafter referred to as the board, which is a body corporate and politic. And whereas the board is empowered by its enabling legislation to provide, and does provide, hospital and other healthcare services, both within and without the district, to support its mission of providing healthcare. And whereas the board has created, established, and registered various corporate entities and names by and through which the district provides hospital and healthcare services, which entities and names have evolved over time. And whereas the board desires that Sarasota Memorial Healthcare System Administration establish and maintain appropriate corporate records, including tax and other identification numbers, that accurately reflect the entities and names through which the district provides hospital and healthcare services. And whereas the board is aware that the current federal employer identification number for the district reflects the name Sarasota Memorial Hospital, which is one of the fictitious names under which the district provides hospital and other healthcare services, but is no longer fully descriptive of the variety of names under which the district does so. Now, therefore, be it resolved that the board directs Sarasota Memorial Healthcare System Administration to take the steps necessary to correct the name on the federal employer identification number to reflect the name of the district. If adopted, this will be effective today, the 17th day of May, 2021, by the Sarasota County Public Hospital Board, and will be signed by your chair.
May I have a motion? All those in favor, please. Question.
What will the name be?
No.
The FEIN will be registered to the district.
Thank you.
You have a question, Daryl?
I did not hear what it was supposed to be voting on. I heard Carol Ann, but I don't know what she was saying.
I'm sorry if I wasn't speaking clearly enough. However, the resolution in its entirety is on the last page of your packet, which you should have received from Karen. So it was also included in writing with the information that we provided to you. Sorry, I tried to enunciate as closely and carefully as I can, but I'm still wearing a mask, and also it was a lot of words.
It's okay. I just wanted to make sure I knew what I was getting ready to say yes or no to.
Okay, so we have a motion that's been seconded. Any other comments, questions? Hearing none, all those in favor, please respond by saying yes.
Yes.
Anyone
If
opposed?
Dr. Fiorica is still there, I have a follow-up question for him.
Daryl, can we finish this, please, first?
Well, we're walking away from where the question fits, but yeah, go ahead.
So
Yeah, I think we voted.
all those in favor respond by saying yes.
Yes.
Opposed? Motion carries. Dr. Fiorica, please.
Yes, go ahead, Daryl.
Yeah. Dave made a comment about monoclonal antibody number 14 and it being available for us to use. Who's the audience it's aimed at?
Who is the audience? Yeah, so this is actually an exciting trial. These are ill COVID positive patients that are hospitalized patients that are deteriorating, and you're trying to minimize their risk of needing a ventilator. So it's in hospital patients, and the way the drug works.
It's being tried as a therapeutic then.
Yes, it's a therapeutic drug for inpatients in hospital.
Okay.
And so it's a group of,
That's
yes,
what I didn't hear before.
yes,
That's
it's a,
good. That's how we have had the therapeutics, right?
yes.
Well, that's wonderful.
It's an exciting trial that we were fortunate to be one of the few centers in the country actually to enroll in this trial. So I think it's a new type of medication for treating COVID patients.
Thank you, Doctor. Having completed our agenda, we stand adjourned. Thank you.